As we wait for those live events, we want to bring you the latest on some disturbing reports out of Quebec. They say conditions at a private seniors' home are so poor, they actually contributed to an outbreak of COVID-19. Laura McQuillan has more on the story and joins us now. So, Laura, a former nurse is going as far as to call the situation inhumane. What can you tell us?
That's right, John, and that same nurse told us how after visiting this nursing home, she actually went outside and cried in her car because of what she had seen inside. This is Residence Heron in Dorval. It's under investigation now over the standard of care that was being provided there. A lot of concern about the conditions that nursing team, after it was taken over by a government agency at the end of last month. We're talking about severely neglected residents there. Some 20 have died in recent times. 2 confirmed to have died of COVID, 18 unspecified causes of death at this point in time. But staff there have told CBC News that as many as 12, possibly more, of those residents did die of COVID-19. Now, as I mentioned, nurses were brought in to back up the staff working there, and they were horrified by what they saw, including that the residents there hadn't been fed, that they were lying in their own feces and urine in their beds. Also that those with symptoms of COVID were not separated from those who did not have symptoms. Here is more of what that nurse told us.
We went room to room, and what we found was inhumane, horrific. The conditions were disgusting. The COVID-19, this whole pandemic, has brought to life a serious breach of standard of care. And we are clearly falling below our responsibility for the elderly.
And that's something that's been acknowledged by other medical experts and in fact by the province itself, John. We know that they are pushing more resources into these nursing homes now, including more of that protective equipment for staff, getting more staff in there and certainly ramping up testing as well. Worth noting, this isn't just that one care home. In Quebec, cases that originated in nursing homes and long-term care facilities now account for half of the province's COVID deaths.